Every leader's journey is shaped by a handful of defining decisions, those moments of risk, doubt and conviction that influence their lives and careers. In this podcast, we get to hear the stories behind those choices. Welcome to Executive Decisions with me, Steve Sedgwick. In this episode, I speak to Vas Narasimhan, the CEO of pharmaceutical company Novartis.
I think it's easy to get too fixed kind of in your career as well. And I think to be open to possibilities that a decision in one direction could open three other decision doors in another direction.
As the son of two first-generation immigrants to the United States, Vas's life and career have been guided by a core mission instilled by his parents.
By bringing me back to India many times in my youth, particularly my mom, she would always take us back to say, you've had these extraordinary opportunities to get to the US, to get an education. What could you do for the world? What could you do to impact the world with the opportunities that you've been given?
After attending Harvard Medical School, Vas considered becoming a doctor, but instead he went to consultancy McKinsey before settling at Novartis. When he eventually became CEO, the company was embroiled in scandal and faced several investigations.
Talk about getting thrown into the maelstrom. It's easy to coach new CEOs about these things, but when you go through it, and it's the first time it's your name and seeing all of that, it's jarring.
These are Vas Narasimhan's executive decisions. I've had the privilege of interviewing you throughout your career as a CEO at Novartis, but I haven't got to know you. And as my preparation for this has gone on, I've just found you unbelievably fascinating already as well. Why don't we start off earlier on, though, with your parents and the importance of where you come from?
Yeah, look, Steve, I always say we stand on the shoulders of giants. And I think about the journey of my grandparents coming from really small villages in southern India, farming villages. My parents making the grand trek from India to the United States, and then growing up as an immigrant kid in Pittsburgh, Pennsylvania, a steel town, but it was a steel town back then. They put inside of me the values that I think I cared for today. You try to impact the world in a positive way. You do it with humility and kindness. You're always trying to learn about yourself and learn about the world. So it's been, I'm very grateful for all that they've done.
Your mother was a nuclear engineer. Your father was a senior executive at Huguenas Corporation as well.
Good research, yeah.
Well, thank you. We tried. Having a mum, especially with that kind of pedigree, is phenomenal.
My mom is a brilliant, brilliant person. And she managed to raise three boys while being a nuclear engineer at Westinghouse while still trying to make ends meet. So I think that was really important for us to see, right, growing up. And then my father, having come from nowhere to come all the way up to the executive ranks, even during his career, he would make multiple steps, really high-risk steps, leave his job, get another degree, bet on himself again and again, always with this kind of boundless optimism. And I think that carried through into me as well.
Yeah. I read somewhere that you one of your key aims as a young man was just trying to fit in. You're coming from an immigrant background as well. Was
Absolutely.
It hard to fit in?
Well, I think it was, but we had a beautiful community there in Pittsburgh. Actually, my parents helped found a temple there, the Sri Venkateshwara Temple. And I actually grew up, even though I was growing up in the United States, I grew up really grounded in Indian culture, Hinduism. Books I now still quote, like the Bhagavad Gita, were important in my upbringing. So I always had a sense of belonging there. But of course, at that time, there wasn't a large immigrant communities in these places where I was going to school. So a big focus was just trying to fit in. Sometimes it was funny. I would only know the words for things in the language I learned first, which was Tamil, not English. And always trying to catch myself when the kids would then laugh at me. I mean, little things like that. Yeah. But it was still a wonderful childhood.
What drove you as a young man?
I think my parents instilled in me this idea by bringing me back to India many times in my youth, particularly my mom. She would always take us back to say, you've had these extraordinary opportunities to get to the US, to get an education. Yeah. What could you do for the world? What could you do to impact the world with the opportunities that you've been given? And going back and seeing that, of course, especially at that time in India, you would be seeing that there are, millions, hundreds of millions of people without those opportunities. And so I always left with that thought that I've had the privilege to have these opportunities. It's not a given, just the luck of the draw in many ways. And then what can you do with that to make the world better?
Yeah. Did you always want to be a doctor?
I think very early on, if you probably saw in the history, even in college, I went to Africa, and I went to West Africa, and I went to the Gambia to work with the Red Cross. And probably it was that experience that more than any other really instilled in me this desire to pursue medicine and public health.
Because you also looked at child poverty in India, and I think you were in Kolkata and other places, studying HIV treatments in Botswana. Part of me can see how you could have gone down that route and stayed with people at Médecins Sans Frontières and working in humanitarian relief, working in the charity sector as well. I can easily have seen you going that way, given your resume.
Well, first, I want to make a call out there. When you go back to Calcutta, that was actually the first trip my wife and I took, and we had only been dating for like 3 months. Yeah. And we ended up working with street children and child laborers in Calcutta together. So think about a love story. That was like an interesting place to kind of try to cut. But it was a crazy time then in Calcutta, but we managed, and it was incredibly rewarding. And then, as you said, to be part of the first HIV/AIDS treatment effort in Africa and Botswana was extraordinary. But, through those experiences, I also saw that in many ways, management, leadership was not very evolved in public health. And so I think my first step into the business world was very much motivated by that desire to learn how to lead, learn how to make change happen at scale. Because I think the history is that usually a great physician is just thrust into a leadership role without any of the experience. And that's what I was observing on the ground. So that's where the initial inclination came from. Now, I had no idea what ended up being a CEO. It was always like, I'm going to go to business and come back to public health. And then one thing led to another.
It's really interesting because more than one of my guests on this podcast, I always knew I was going to be a CEO. I always knew that was the aspiration as well. But for you, that wasn't the goal. You weren't making an early decision to be a CEO.
I think the idea of becoming a CEO only fully occurred to me 6 months before I became CEO of Novartis.
Genuinely?
Genuinely.
You had a whole series of management roles. We'll come to your evolution of your career from 2005 onwards over at Novartis. But I would have thought that it would have been at the back of your mind.
When the global head of human resources then at Novartis said I was one of the candidates that they were considering for the CEO role, I thought he was actually joking. I mean, I was like, me? I'm like a physician scientist working on drug development. Yeah, so it never occurred to me.
Sorry,
honestly.
Vas, you're one of the smartest people I know. How did you not spot that?
I missed it. I'm kind of another thing my parents gave to me was this notion you have to throw yourself fully into whatever you're doing at that moment, because who knows what comes next. And don't worry about the result. Throw yourself into the process. Whatever role I was in, I was all in. And it never was thinking about, and that's best advice I'd give to young people listening. Don't always think about the next role. I mean, think about how you can maximize the experience of the role you're in.
You are a very smart guy, although you're the second smartest person in your marriage from what I can see. Your wife's got more Harvard degrees than you.
That's absolutely true. Absolutely true.
But you kind of found it easy to talk to smart people on a smart level, but actually, hence you mentioned the scientists, but on a broader level, not everyone's got your IQ, Vas, and did you find it hard to relate to the rest of us, the mere mortals of us out there?
Well, I think there is that element of communication, but I think there's also an element of getting to what are the underlying things that drive people and really understanding that it's okay that people have different motives and different drives, but you as a leader have to find a way to tap into that and really get people to do extraordinary things. That's what we tell leaders. Leadership at Novartis is getting ordinary people to do extraordinary things. I mean, that's what we need to be able to do.
Autonomy, mastery, purpose. It kind of covers it, doesn't it?
Mastery and purpose. Yeah, so Daniel Pink's work, and I've talked to Daniel now, it's still ongoing for many years. I still believe he's got it. For most people, once you pay them enough, it's not paying them more, it's not going to motivate them even more. But it's the idea that they're working for something that's bigger than them, that they have the freedom to do that work, which we later called unboss, and then the opportunity to grow as people. You should really be talking about mission and purpose 3 times more than anything else. I mean, many people have talked about this, Simon Sinek, Adam Grant, many of the leaders that I really...
Think again, Adam Grant,
start with why. Leaders start with why, and you should be talking about the why we're doing the work 3 times as much as the what and the how, because that's what really can motivate people. But the art of it is not just the big, what I've learned over the years, is not the big P purpose always. You also got to bring it down to the little P purpose. I love the story of people who work in our manufacturing facilities, cleaning the facilities. And when you ask them, why do they do what they do at Novartis? They say, we're saving people's lives. Yeah. Because they've connected the work they do in that facility to the bigger purpose. And so you have to be able to make those connections. It's not enough just to say, let's reimagine medicine, because somebody in our organization 7 to 8 levels down has to understand what that means for them.
I want to just mention your wife as well, because we've already talked about her. She's an incredible woman in her own right. She's the CEO of Vidorsia Pharma now as well, lives with you in Basel with your kids as well. She's got 4 Harvard degrees, which I hasten to add is more than you, isn't it? I think
it is.
But you've mentioned her about 3 times. So she deserves an honourable mention as one of your kids. She's your partner in this, isn't it? This isn't just you, the CEO. This is you together, isn't it?
Absolutely. And my best friend as well. But I think throughout the ups and downs, we've been on this project, whether it's the streets of Calcutta, whether it's the hospitals of Africa. Now, interestingly, both as biopharmaceutical CEOs. I'm not sure if it's true, but I think we might be one of the few or the only married couple that's both CEOs of public companies, maybe in the world, which is kind of incredible thing. So it's been extraordinary, and I would be nowhere without her, for sure.
One thing that's really clear is having one amazing career is tough on the family and is tough on the relationship. Having 2 amazing careers, you must have to make some really tough decisions. And again, this is not a Novartis thing. This is about you and your amazing partner in life. How do you make those decisions about what you prioritize and when you prioritize?
Yeah, I think early on when the boys were young, we have 2 incredible boys. Early on, actually, I took the lead. She was traveling. She was a McKinsey expert. She was traveling around the world working on projects. I was kind of muddling my way through as best I could, trying to get the kids to daycare. Then, she took the lead on the kids, and my career at Novartis really blossomed. And then, look, when the opportunity to become a CEO came up, we talked with the boys, and we said, "Are we willing to do this as a family?" And my boys said, "We want to make this happen for our mom." And so we figured it out. And so it's not always easy. I don't have a magic formula to make it happen, but we figure it out.
Quickly, you just mentioned McKinsey. Why did you join McKinsey? After all the most amazing life experiences you'd had from Botswana to Gambia to Calcutta, you end up at McKinsey?
Yeah, it was interesting. But I am very grateful. I was there for 18 months, 20 months. But in that time, I learned so much for somebody who'd never been done an MBA or knew anything. I didn't know what a balance sheet was. I didn't know anything about P&Ls and valuation. And I had been trained in medicine. And then I learned all of that, and I got to apply it in the business world. I think of it as I learned another language. Like, you have to, as leaders, you have to be able to speak different languages. You have to speak my role, medicine, public health, finance and business, and you have to be able to communicate. And I learned that.
But that decision speaks volumes to me. You didn't go to one of the big hospitals. You didn't go to a big teaching hospital to carry on that side of your career. No. You went to McKinsey instead because you knew you wanted to make a bigger impact in health and health services. It wasn't going to be medicine. It was going to be scientific.
I wasn't exactly sure. I have to be honest.
And that's the point. Young people shouldn't be sure.
Shouldn't be sure. I mean, I think people watching should know. These were all just experiments. I was in my kind of late 20s. I was like, let's give it a shot, right? Yeah. Maybe McKinsey will lead to something, or maybe I'll just go back to medicine. And I had no idea where it would go. And I had no idea that McKinsey would lead to Novartis, right? So then when that happened, and then suddenly I was sitting in Basel, Switzerland, working for a pharmaceutical company. Certainly my mother was asking me, what exactly is the plan right now? So I thought you were going to be working at a hospital. You're a Harvard Medical School grad.
I'm with your mom. This is where I was going with your history.
Exactly. And it wasn't a carefully thought through plan at all. It was kind of just trying to see where I could learn, where I could have an impact, and just kind of.
So I love this. A huge decision. You've had this unbelievably expensive education. I'm sure you got a loan the size of it. Well, maybe you didn't. I did. Yeah. So, and you've made the decision to go to McKinsey to learn more, and then you've ended up at Novartis. 2005.
2005.
Tell me how that process worked and the decision making. Did you make that more of a decision, or were you just winging it still?
I kind of always thought to follow people I respected, and there were some great leaders there that I respected. We got a gentleman named Amit Malik, who's actually now still a biopharmaceutical CEO. He told me, "Look, you should come, and I think you can learn a lot and have a huge impact." And so I trusted him, right? And I think a lot of these, look, in life, you also trust the people that you who believe in you. And that can open up a lot of doors. And that actually ended up being quite a decision to take. Though at the time, again, it seemed like a very strange decision to take.
A whole series of roles between 2005 and late 2017, early 2018, when you became the CEO. Tell me about some of the great decisions you made in that period, and tell me about some of the howlers, where I presume you learned also a lot.
I mean, so the big one was at 2006, after 2 years at Novartis Pharmaceuticals in the main ship, Basel, Switzerland. I went to the newly acquired vaccines division, which was losing money, had a very small piece of Novartis, 2% of Novartis' sales. And at the time, seemed like a very strange decision. Again, so I have a series of strange decisions. always trying to follow mission, learning, purpose. That ended up being one of the great decisions. Because what happened is when you go to a small unit and you get huge responsibility, your learning curve goes up through the roof. So I was suddenly overseeing clinical programs and development programs in our world, important things to know, all the way through to marketing launch programs. I had to solve all kinds of issues, and it was fully immersive. I ended up being 7 years. I was there 8 years. I was in that division. And it was actually incredible. Before I knew it, I was running a unit and I was testifying in front of Congress about the H1N1 pandemic. And I wasn't even 32 years old at that point in time. Wow. So I think that was one of those decisions where at the time, it to most people seemed like a really bad decision that in retrospect, I mean, for my growth, it was incredible. Really, really
And that's incredible for me. I've just learned something again from this, and the fact that I've had so many conversations with you about, and the rest of the industry, about biotech. Why do you need them when you've got the big pharma? And you just answered the question. It's the autonomy and the speed of action and what you can do and what you can learn and the responsibility that you as an individual in a smaller group get.
Absolutely. And you can make some big wins because you can take the risks, because the downside is not as, look, Novartis has to manage a huge risk profile. I mean, we're a 270 billion market cap company. When you're a small unit just trying to experiment, you just have to figure it out. Sometimes you'll win, sometimes you won't, and that's okay. So I think that was a really, really interesting decision. The other one I'll tell is, and I don't know, again, it's always hard, in Buddhism to say who is to say what is good or not good, because often things that seem good at the time end up being bad. Sometimes we think bad at the time end up being good, but it's all just the cycle of how these things work. I remember in 2014, Novartis actually sold the vaccines division to GlaxoSmithKline. And at the time, I wasn't exactly sure. If you can imagine that less than 4 years from there, I would become CEO of the company. I did not have a next role at Novartis. And I wasn't exactly sure, would I go with the acquisition to GSK or would I find a role? And then I got a call from our CEO at the time and said, we're going to send you to the generics division, Sandoz, in Germany, and immersed myself in it. And then 5 months later, I got another call, and I was the head of drug development at Novartis Pharmaceuticals. And 3 years later, I'm the CEO of the company. So these are really hard to predict how these things unfold.
Yeah. I would imagine as part of you may have thought, I really like this autonomy. I like the scale of the company. I'm going to stay with either this vaccine company with Glaxo or actually go elsewhere and become a vaccines CEO or a biotech CEO.
I think it's easy to get too fixed kind of in your career as well. And I think to be open to possibilities that a decision in one direction could open 3 other decision doors in another direction.
Tell me about something you got really badly wrong early in your career. Everyone I know has, and everyone I've interviewed pretty much, I thought this was going to be the moment where I'm booted out the door kind of thing. Did you have a 1 or 2 moments where obviously you learned from it, but you had a really hard time at the time?
Well, I think certainly coming back, I mean, there are many of these moments, as you can imagine. But, I think one that comes to mind in that early part of the career is, as a very ambitious leader of Novartis Vaccines North America, I convinced the U.S. government to actually have us become the number 1 supplier during the swine flu pandemic. And we were the number 1 supplier. We won the contracts. And then that summer, we weren't able to deliver initially. And I still remember the meetings with our then CEOs and chairman, and that I had put the whole company's reputation at risk by ambitiously signing up for these deals and then not being able to deliver, and then being hauled in front of Congress as well to testify about it, and being called by the chief of staff of the White House. And that was the tough summer. But here's the interesting thing. I mean, what I also learned in that experience is to go to manufacturing sites and really try to talk to people in town halls and say, we can do this. I know we're behind. We can get there. We can get there. And we did get there. We did deliver.
So you motivated people as well.
You learn how to motivate people with a gun to your head, of course, and we figured it out.
How was it mentally for you at the time? These failures, these setbacks.
Setbacks, yeah.
At the time, I had one CEO saying on one of the similar, I was in a fetal position. I was so upset. I had another one saying, I was making really bad decisions. I had high levels of cortisol. My mind was, I couldn't sleep. I hear a lot. What about you?
I think earlier, I mean, now I'm more zen about these things, having gone through the ringer many times. But then, tough to sleep. I mean, it's completely normal. I can tell you as a physician, I mean, these are the fight and flight responses. Used to be we were chased by animals when we were evolving as an ape species. Now it's the email you get saying, what the hell did you just do, right?
welcome to my life at CNBC. more like, what did you just say?
and then of course you have the cortisol going. You don't sleep. You're under huge stress. And of course, the hardest part is how do you insulate your organization from that? So I found over the years that it was so important that you absorb it, and then that's very heavy load on you. But if you let it pass through you into the organization, then the organization just simply cannot perform. You have to be an absorptive buffer.
Yeah.
And that's hard. And that's really hard on all leaders. So I think that's something we all have to contend with.
Let's spin forward to the succession process from Joe Jimenez. 2017. Tell me how it worked and about the decision you made to accept that role, because you've already said on this podcast as well, you never expected to be the CEO.
I think that was the moment when I actually just sat down and I said, I'm going to write down what I believe this company should become on a single sheet of paper. And I think I still keep that sheet of paper. And it was very much around the cultural transformation, inspired, curious, and unbossed. Not quite those words yet, but that Dan Pink concepts I wanted to bring in. That I truly believe that we should be a pure play innovative medicines company, and that we should bet on technology, innovation. I called it data and digital. I didn't know about AI. So I wrote, go big on data and digital. That became kind of the manifesto. Now it took like much longer than I ever expected to do all of those things. But yeah, that was it. And then I went through the process, and I remember still, it was a board meeting. I got called in by the chairman. He told me I'm going to become the next CEO, and I was really incredibly excited. I ran upstairs to call my wife Shrishti, and she said, "Look, I'm in a meeting. Could I call you back later?" And she just quickly hung up. So I was like, "Okay, I'm not allowed to tell anybody." And then the funniest thing, I was actually had to go to fly to another meeting, and I was actually on a Ryanair flight. We were in Dublin, where this board meeting is. And then I was like delayed in the Ryanair in Dublin airport for like 12 hours. And I was like, here it is. I've been named CEO of this giant company. And the reason I keep coming back to that is it's how do you stay humble and grounded throughout the whole thing, right? And I think it's so important.
Well, I think you stay humble and grounded by traveling on Ryanair. All due respect to the great Michael O'Leary. That's as humbling as it gets.
Yeah. A good reminder.
That's
good
hero
reminder.
To zero stuff as well. The first year of CEO was rough.
Yeah,
you walked straight into a crisis.
Yeah.
For our viewers and listeners, 3 months into the post, you had to apologize to employees, and indeed, you were hauled over the coals publicly with a lot of truths and a lot of untruths as well about the fact that your company had hired Michael Cohen's consulting company in February 2017, which is way before you became CEO, a 1.2 million year-long contract as well. That was perhaps in retrospect, I think very clearly, not the right thing for Novartis to do, but you had to bear the brunt straight away.
Yeah, I think that first 6 months, we had the Michael Cohen situation. We also had a very large Greece investigation from the SEC DOJ. We had another investigation into practices in Asia, and talk about getting thrown into the maelstrom. And you know, I think it's easy to coach new CEOs about these things, but when you go through it, and it's the first time it's your name and seeing all of that, it's jarring, right?
I remember talking to you about it, and I'll put my hands up here. You stood up, you took the questions. You know, this wasn't your mess, but you'd inherited it as a senior member of the team that had hired Michael Cohen, and now the CEO as well.
Yeah.
Unbelievably tough.
Very, very tough. I have to say, I mean, I made some missteps throughout that whole process.
What mistakes did you make?
Look, I think I should have owned it on behalf of the company. My first response is, I think I even said on, maybe it was on CNBC, look, this didn't happen under my watch. That doesn't matter. Right now, I'm the steward of the company. I need to own it. And I think in retrospect, I should have just said, doesn't matter. Our company shouldn't have done this, you know, and we need to own it and then step forward. So I think I learned a lot in that whole process, that first 6 months, because then it came straight to the Greece, the Alcon investigation in Asia.
And then 2019, the FDA investigation to manipulated data on a gene therapy as Zolgensma as well. Yeah. I mean, you are firefighting from day one for a good 18 months.
Yeah, it was 18 months of trial by fire. It builds a thick skin, that's for sure. You need that in this job, but it's hard to build a thick skin without taking some of the
Did you question then at any moment your decision to become CEO?
No, I think I was at that point. I'm kind of Another thing my parents instilled in me is you stay in the ring, and because in the end, just staying in the ring is hard enough, right?
Yeah.
And if you can stay in the ring, stay resilient, that you can overcome if you just keep getting back up.
You're getting a lot of brickbats thrown at you from people who've never been in the ring.
Absolutely.
And if they haven't been in the ring, and I feel like this on CNBC, I didn't care what they say. If they've never been in the position, they don't understand what it's like.
They don't understand what it's like. But, I think I have a much more mature perspective then. But I mean, back then I was very angry at the journalist community. I was like, why are they bashing me? And it was tough.
You didn't show it to me, but which I'll take on board. Look, another really, really, really tough decision amidst the pandemic, eliminating 10,000 jobs. That is without doubt the toughest decision of your career, isn't it?
For sure. I mean, and these were all things I kind of always knew that we needed to do and that I struggled with, I think, because it was the pandemic. There was always a reason not to do it. A company I had grown up at, a company where I knew so many people around the world. And then to take out over 10% of our workforce, many people I knew, was really, I think, a tough decision.
Funnily enough, again, I spoke to the CEO about a very similar decision that he had to make when he became CEO. Same kind of numbers. Huge, 10,000 plus people as well. He said, as long as you do it with respect and you're respectful to the employees which you're letting go of, and the employees are still there, and you explain to them exactly why you're doing this, then it's a much easier process.
I think to a person that I would interact with, they all understood, because we really took the time to explain why, like why strategically this makes sense, why we need to focus as a pure play, why we need to simplify, why we need to streamline down the pipeline. And spending that extra time saying why, I think people understood. Now, there's still the personal impact of individuals leaving. And, Basel's a small place, so everybody knows everybody. Yeah. So a lot of people, my kids' friends, parents, and so it was a tough time. It turned out, as you've seen the performance, it was the right move, but that's not a given. And I think, it was a tough couple of years.
I would imagine in your position, there is nothing more exciting, nothing that validates the decisions you've made when you get drugs through, drugs that change people's lives. I want to know about that feeling when you've backed a drug, it works, it's got past stage 3, and this is going to make a big difference.
I cry every time we have a phase 3 win.
That doesn't surprise me.
Because, I mean, many of these projects I've been with since 2013, 2014, or I started them, or I know the teams, and most of them sadly don't work, right? And when you have one that really changes, in the case of Kisqali, the whole shape of breast cancer therapy, or Pluvicto prostate cancer, or Semblix, again, cancer, chronic myelogenous leukemia, I mean, it's an extraordinary moment. And it's not just those. I mean, one of my favorite ones happened last November. We discovered and successfully developed the first new malaria drug, coming back to my time in Africa, in 25 years. And so for me, flashing back to sitting in a hospital in Tanzania and watching children die of malaria, knowing my company has provided Coartem to 1.2 billion people, and then making that next discovery, of course you cry. Because you put your whole heart and soul into this work. That's the only way you can do it.
We've covered a lot of ground about your personal ethos in making decisions. Just tell me how you want to put into words your ethos and your values when you make decisions.
There's so many things we can be doing with our energy and our time. But one thing I've learned through this transformation process is we have to stay focused on what we're great at, discovering, developing the most cutting edge medicines. Just to give you an example, people always say, why don't you get into devices? Why don't you get into diagnostics? Why don't you buy an AI company? And, I think we have to stay on mission. That's the first step. Second, is it consistent with our responsibility to the stakeholders that we have? So people often ask me, why do you still guys do malaria and leprosy and neglected tropical diseases? Well, that's aligned with our mission. And we've made a commitment to global health for 100 years as a company. We've been the leader in global health and engaging in medicine in Africa. So we have to keep our commitments to those stakeholders. And then, of course, can you execute? I mean, in the end, there are sometimes things that are both of the first two things, but we're not the right company to do it. And those are tough decisions, right? You can find, I'll give you an example, a rare cancer medicine that aligned with our mission, consistent with our goal to deliver medicines to cancer patients, but too small to move the needle for a 60 billion revenue company.
Yeah.
And then we have to say no. And that's hard to tell those scientists, look, there's a biotech who's better served to do this. But those are also the tough choices we have to make.
I want to talk about you personally and the decisions you make in your life. I look at myself, and I'm actually going to compare myself to you now. I'm like a poor man's Vas Narasimhan. I monitor my blood sugar. I try and sort my sleep out. I'm concerned about my mental health, physical health. I work on all of these, and I work on my sleep. I've got a sneaky feeling you work on all of those a little bit better than I do, because I know that they're actually part of how you try and conduct your personal life as well.
Well, so first, don't believe that's true, Steve. You're looking great. But
Can we just cut that bit as
But look, I would say, I do believe, and it's been consistent. And I had, a great friend and coach, Scott Pelton, who's helped me with this now for 15 years. Mindset, movement, nutrition, and recovery. Yeah. Mindset, can you put yourself in the right mindset every day to have high impact? Think about your high impact moments. Realize you're not your thoughts and emotions, and you have to be able to observe your thoughts and emotions to be able to navigate the craziness of what we have to deal with. Movement, I think any form of movement, but being more consistent, whatever it is. And I'm a big exerciser, but being consistent has huge benefit. Nutrition, I always say, why do you eat? So sometimes I eat for performance, sometimes I eat for pleasure, but I don't just eat to eat. And that's very easy in today's world, where you're surrounded by food everywhere. So purposeful eating, and then of course recovery. And now my biggest obsession now is sleep, with all kinds of approaches to try to figure out how to sleep better, because I think sleep is the ultimate medicine in the end. But I think the biggest thing on all four of those is whatever you choose to do, just pick things and do them consistently.
Yeah.
The hardest thing is to do these things consistently, because the benefits just accrue and compound. And people ask me, like, how do you put up with the travel? And it's because I do those things every single day in some form. And then over years, the benefits compound.
I'll bear that in mind. It's my consistency, and I will go for that run again tomorrow. Final question. What are the big decisions for you personally going forward?
First and foremost is helping my sons navigate their transition into college, and really, with my wife taking on her leadership role, I've had to learn how to become more of a lead parent. So that's really on my mind. I mean, I want to make sure they have the next step sorted out. And then, of course, at some point, like, what's next for me? And I think one of the hardest things as a CEO is you can only go into this 200%, 300%. I have no idea when the moment will come, but when the moment comes, like, yeah, now what? I mean, I've had the greatest job I could have ever imagined in my life, had unbelievable impact on the world, on Africa, on the planet, on medicine. So that's kind of a daunting challenge, I have to say. And I don't have any insight. Maybe I'll come back to you, Steve, for some advice. Since you seem to know me really well, you can counsel me on whatever.
I don't know if I know you really well, but I've learned a lot about you for this podcast, and I've loved the journey as well. So thank you so much indeed for your time, Vas Narasimhan.
I appreciate it.
Well, that was a great conversation with Vas Narasimhan, both personally and professionally. He's just so interesting. He's always wanted to make an impact. He's got such great role models from his education, but especially from his family. His hardworking immigrant parents really instilled the desire to make an impact, but strong ethics within him as well. 20-year plus career at Novartis, he's always wanted to progress humanity, to get these drug breakthroughs, which he said himself, they make him cry when he has them, because he knows they're going to make a positive impact in people's lives. Personally, I want to be Vas Narasimhan. He concentrates on his sleep, his health, his mental health, his physical well-being, his nutrition. He's kind of a role model for a lot of us as well. A really fascinating guy. Thank you very much indeed for joining me on Executive Decisions. I would love to hear your feedback. Drop your thoughts in the comments or a review. And please hit that follow or subscribe button.